Calling all ninjas. Calling all ninjas. It's time for Lyme Ninja Radio.
Hello, and welcome to Lyme Ninja Radio Live. We're calling it the Lyme Ninja Radio Show, right, Aurora?
So, yeah.
I think we've kind of
Lyme
settled
Ninja
in on
Radio
that.
Live.
Welcome. Thanks for joining me and Aurora and our special guest, Greg Lee. We're going to bring him up here in a second. We're so happy to have you here. This is episode number, whatever it is. We kind of lost track. Switching over. 269. Yeah.
That's what we're at.
We're cranking up there. And we're going to talk again about ways to treat viruses, and particularly that nasty virus that's going around the world right now. And my good friend Greg Lee has incredible amount of experience. He got started treating Lyme disease 20 some years ago. And then what happened is he became an expert in essential oils because that was one of the main treatments he found to really, really work with chronic Lyme and people who are really stuck there. And he's custom blended mixtures for his patients for many, many years now. So he's my go-to guy because it's not only that he's got the academic knowledge about essential oils, but he's using it every day in his clinic. So he really knows what he's talking about. He's one of the few people who's using this clinically every single day. So I really value and respect what he has to say. And before we get started, go ahead and let us know where you're from in the comments. We would love to hear and say hello to you. Some of our friends out there who are listening. So just go ahead and say hello. And all right, let's see. Everything else looks okay here. So Aurora, why don't you tell us a little bit about Greg Lee, read our bio.
All right. Greg Lee, who's a master acupuncturist and a licensed acupuncturist, is an acupuncturist and a Lyme specialist, the founder of Two Frogs Healing Center and GoodbyeLyme.com. He's been treating Lyme for 20 years using his experience in acupuncture, Chinese herbs, cranial sacral technique, and Sufi healing to help people conquer this disease.
Awesome. So hello, Christine. Hello, Paula. And goodbye, Aurora. Thanks, Aurora.
Bye.
We'll bring you back on later on the show. And Greg, you are up now. How's it going, man?
Long day, but happy to share with you what I'm finding is, helpful for patients that are concerned about the coronavirus. And so, really excited to be able to be on with you. And thanks for doing this, McKay. Appreciate your tireless service and providing this to the people out there.
Yeah, it's long days for everybody these days, isn't it?
Yeah.
So what have you discovered? I mean, well, actually, back up one second here is like, when did you get interested in essential oils for Lyme disease? Like what brought you in that direction? Because, you're a Chinese herbalist, you're an acupuncturist, you've got that side of the world. Why did essential oils kind of bubble up and become a go-to therapy?
Well, I found that there are certain patients that I would just give them lots and lots of herbs, and they were tinctures. Some people had like raw herbs they'd go home and cook up, and they come back and they'd say, oh, it stunk up my house and my kids complained and I'm never doing this again. And then it was just like, I said, okay, I'm going to do powders. And no matter how much I've given some patients, they still have neurological symptoms, joint pain, inflammation that just wouldn't get better, like relapse and kept coming back. So I was fortunate enough to encounter a naturopath in Alabama, Dr. Kasner, and he had studied using essential oils internally from a French system. And I was like, whoa, hey, that's something that really piqued my interest because, they're really different form of plant extracts, yet highly concentrated. And they're known for being able to kill other kinds of infections. So I figured, hey, they should be able to kill Lyme too. So.
Yeah, that's awesome. So now, fast forward, we've got this pandemic sweeping the world. What overlap is there, if any, with Lyme disease? And so what have you found with the interaction with the essential oils in that kind of the trifecta there between essential oils and Lyme and coronavirus on the other end?
So a lot of the essential oils that have been found in lab studies to inhibit Lyme, well, not a lot, but some of them also can be useful to help with the Chinese hospitals are sharing, hey, these are the challenges that we're seeing with our patients in different stages. And then they're saying these are the herbs that correspond and are helping our patients in these hospitals. Because now I think it was like 85% of the patients in China are getting not only antiviral medications, but also herbal remedies. And they're finding, there was one report I heard from Dr. John Chen. He's a pharmacist, Chinese herbalist, and he has a company that, that brings Chinese herbs into the country. That he had translated that these doctors were finding that the patients were getting better. The ones that were like, severely sick with pneumonia and their lungs were just filling up with this thick stuff that they couldn't cough out, that the herbs were helping to clear out the inflammation that was just stuck in their lungs and helping them to, resolve other symptoms more quickly.
So what are the top essential oils that you're finding useful?
Well, there's different oils for different phases of the illness.
I'm glad you brought that up. That's so important. That's so very important, because we're kind of treating it like, okay, there's this one thing, you go out there and you sit on its head, but it has phases, right? And it builds differently, and your body responds differently in these different phases. And that's what we're seeing for the people who are really, really sick. It's totally different than somebody who's asymptomatic and needs some support. So please elaborate there.
So the COVID-19 is, I guess, supposedly there was an initial coronavirus called SARS, now referred to as SARS-1. And then they did the genetic testing on that. And then they've genetically compared it to the COVID-19 or SARS-2 coronavirus. And there's a 96% similarity between the two. So they're very similar. So that gives hope in that remedies that inhibited the SARS-1 virus can also be effective against the SARS-2 COVID-19 infection. And so from what I'm reading about the research, patients can have this thing incubating in them for up to 2 weeks. And there are some patients now that they're testing that don't have any symptoms, but are yet testing positive for the infection. And that was a recent news item out of China. And so what they're looking at is like, not only can it live on the skin, it seems to infect the sinuses and throat tissues initially, and then it takes about 5 days to migrate down to the lungs. And really, once it gets there, it tends to have a huge increase and exponentially grow once it hits the lungs. And they're finding that, initial symptoms often are like sore throat because it's in the throat, fever, dry cough, sneezing, runny nose, shortness of breath, and it's hard to distinguish from the regular influenza. So that's one of the challenges in diagnosing it. I heard a news item out of Russia, how, they have very few cases, but they have this huge explosion of pneumonia in the hospitals in Russia. So they're like, how many of those are really this coronavirus? And according to Dr. Chen, the infection produces this huge inflammatory response, which they call a cytokine storm, which overproduces all this immune gunk in the lungs and the body. And it just overwhelms, can be overwhelming to a patient and their immune system. And so, then it produces severe inflammatory diseases in the airway, pneumonia, and eventually can produce organ failure. And unfortunately, as we know, thousands of people have died from this infection. So it's really a serious issue, especially for those most vulnerable, those people, what I believe I've heard is 60 and over, and also have a pre-existing condition. So that's kind of the background on it that I, have heard about. And there's estimates about 70% of the population of the world are going to get this. So it's like not just a, isolated pocket, but I think because there's so many people who are asymptomatic, or they're finding those people that they can just still transmit the virus to other people, then that becomes very hard to contain, and that might lead to 70% of the world being infected. So
let's move on. Let's talk about the first phase, and what are oils that you would use to defend against catching, really, and this would probably hold true for any virus, right? Any type of viral thing. What can you use to keep yourself clear?
So
we won't say prevent, right? We're reducing risk here.
Well, they call it prevent. So. Dr. Chen called it prevention phase.
Yeah.
So in Chinese medicine, they talk about defensive energy, or what they call wei qi. And they talk about things like draining inflammation, or they call drain dampness. And they have like supporting the lung qi, or lung energy. So there are different essential oils that can help with that. There's Angelica, Archangelica, basil, cinnamon, Eucalyptus globulus, ginger, neouli, rosemary, spruce, tea tree. And then there's different combinations that correspond to different Chinese herbal formulas. One of them is called like jade windscreen, Yu Ping Feng Shan, or Wan, I guess. Peppermint and fir essential oil in a combination, or lavender and cypress together in a combination. And then people can diffuse that in a diffuser. They can do it topically. They can do it nasally. They can also do it in their mouth, because, they want to get it into the throat and gargle with that. And since you want to support the lungs, in Chinese medicine, you have the lungs and the colon are kind of like brother and sister. And you find if you deliver things in a suppository in the rectum, then that can also get and help support the lungs with those essential oil remedies.
You may have just lost half our audience right there, but it's rectal administration is a major way, especially when your lungs are blocked, to get things into the bloodstream, especially to the liver in a hurry. Now, you mentioned it was lavender and eucalyptus. Is that what the combination was? Did I get that right? Lavender and...
Yeah, it was lavender and cypress.
Sorry.
But the ones that seem to correspond, that the essential oils that have the properties of strengthening defensive energy, draining the inflammation, supporting the lungs, are like basil, eucalyptus, globulus, and rosemary. Those seem to have those properties the strongest of the other essential oils that I mentioned. So my go-to right now in the office is I'm diffusing eucalyptus globulus. I diffuse it at home. Now, there's a caution: if you're diffusing it, shouldn't do it around pets, because pets metabolize essential oils differently. You don't want to hurt them with that. So just make sure it's not in the presence of them. And what we're doing also is taking isopropyl alcohol, mixing it with essential oils, and using that as our disinfectant.
Just spritzing it around
knobs, light switches, the pens, everything,
right? Yes.
It's like,
hi, here's your very own crayon, and take it home with you, please.
Right.
Yeah, it's kind of like that. Now, for the second phase, when people are starting to show some symptoms, what do we have?
So in the Chinese medicine way of kind of showing how this progresses, it kind of like says like it's outside you, and now it's got into like the outer layer of you. It's what they call an invasion of like wind, cold, and that's when you get those like flu, cold like symptoms. And so one of the strategies is to use bay laurel essential oil, because that has been effective in a lab study against the first SARS coronavirus. So that you put that around, and I don't think they've tested it in diffusing mode, but more in like a petri dish or something like that. But the thought is, hey, you do that, then whatever it touches, it hopefully kills the SARS-2 coronavirus. or the COVID-19 one. And then there's
And
also,
are you using that rectally as well, or is there other ways to use the bay laurel?
yeah, you can do that rectally, and if people feel like they have want to get it deeper in their system, but since it's still on the like outer layer, you can probably diffusing or topical or oral nasal is probably going to be enough, because you're targeting the sinuses, the throat. It's not yet in the lungs yet, so you may not need to go to suppositories.
So the second level is when you've got the sore throat, you're feeling it, you're stuffy. It's kind of those initial flu symptoms. So you're not really coughing yet. That's correct. Is that what you're saying?
Yeah, you are having that cough. You're having like cough, cold, flu symptoms, because
okay. So you are starting to have the cough. Okay.
Yeah, so it may not be in the lungs, like creating phlegm yet, but some people get
irritated.
Yeah, and then there's other antiviral essential oils that inhibit influenza or norovirus, and those are tea tree, lemongrass, melissa or lemon balm, and oregano. So those are also candidates for diffusing or putting into carriers to use topically, orally, nasally, and if that would be the ones that I would say for the early phase protection.
Okay, awesome.
And then
so we're kind of covered.
Here's another list. There's the different hospitals have come up in China, have come up with different like remedies and formulas, like herbals that they use to treat the early phase. And there's another one that I took the herbs and say, okay, what are the corresponding essential oils? So there's a longer list of those on the second treatment for the early phase. So that would be bergamot that's rectified, birch, which actually is, you can't use birch internally. I just looked it up and I was just like, whoa, hey, this is great. That's a new thing for me. I just learned lavender, melissa, neouli, palmarosa, peppermint, ravensara, tea tree, wintergreen, birch combined with fennel, and ginger combined with coriander as other oils that can be in an early phase, that kind of initial cold flu symptom, presentation.
Yeah. Now I know Greg is going through these things really fast. What I'm going to do is I'm going to go back through this recording and I'll transcribe them all and put the list together for you. And unless Greg, you have a list somewhere already written up. Hint.
I can send you the slides and give them to you, and you can share the slides.
Okay, that'd be awesome. I'd appreciate that. So let's talk about the last. So people are now really starting to have trouble breathing. They're really generating a ton of this phlegm. The cytokine storm has tilted in the wrong direction. Their lungs are producing all this phlegm. It's getting really sticky. They're really generating what seems to be an asthmatic type thing, where they're in danger of not being able to breathe and dying.
So they call this, one of the translations is pneumonia phase. And so essentially you're getting out this damp, inflamed stuff that has clogging up the lungs. And the strategy for essential oils, are similar to the similar ones that we've seen before, but also there's some new ones. So I'll give the list of like angelica and bergamot, rectified, birch, cedarwood, celery seed, chamomile, German chamomile, fir, frankincense, helichrysum, lemon, sweet marjoram, myrrh, myrtle, palmarosa, sage. It's used externally, sandalwood, tea tree, and then a combination of cinnamon and helichrysum. And then also, since you have the bay laurel being effective against SARS-1, also using that to treat the actual infection, versus the initial list of oils were more about treating the Chinese medicine diagnosis of clearing the inflammation and congestion out of the lungs.
All right. Awesome. Thanks, Greg. Do you have a few minutes to answer some questions?
These are internal.
Okay, wait, go ahead.
These are going to be internal,
those are all internal,
except for sage. So, the delivery method would be like oral, make them into a liposome, because a liposome, when you take it will, as it goes down, go right into the lungs more directly. And also, breathing them in through, nebulizer or a diffuser, probably not nebulizer. Shouldn't say that. Just say diffuser. And topically, nasally.
So what are some of the concerns about taking these internally? So you read the bottles for most of the oils that you guys said, don't take these internally. And I know I'm studying with you. I have taken them internally and have given them the patients internally. And so is that something that you recommend to people to do on their own, or is that something they really need to see a practitioner for?
So, need to be medically sound here and go someone who's trained on the internal use. There are people out there trained in this and in a safe and efficacious way, because I know the tendency for a lot of people would be, I'm going to try this and do it. And, diffuser, you're probably fine, but taking them internally, unless you know like what safe dosage is and amounts, then you're risking possible side effects, which may be, we're making things worse. So always work with a trained practitioner, please.
Thank you, Greg. So let's bring up some questions here. And Christine asks about quality of oils. This is always one of the first questions we get when it comes to quality. Do you have any comments about that?
Now we have another like group of oils that are also for this pneumonia phase. Do you want me to go into those before we get into the questions?
Oh, yes.
There's more.
So there's more. Hang on, Christine. We'll come back to you.
Yeah.
All right. So I thought there's 3 phases. There are 4 phases.
No. This is like what I did was they had, hey, here's this herbal formula that's used for treating the pneumonia phase. And then this other hospital says, well, we're using this formula. So then taking those formulas and saying, oh, that corresponds to these oils and the other one corresponds to these other oils. And then,
okay.
So that's why it's not just, one way to treat the pneumonia. There's multiple ways. So
many. Okay. Yeah. I hear you.
So the next set would be Angelica Cajeput, camphor.
What is that?
Cajeput. It's like a very tea tree like, maybe a melaleuca if I remember correctly. I have to look it up. I don't remember.
Okay.
Cardamom, cinnamon bark, cypress, dill, eucalyptus globulus again. Frankincense actually has very strong lung supporting properties. Ginger,
really?
Helichrysum, neouli, rose, styrax, which is a resin, tea tree, and turmeric. So many of these are these like aromatic, strong odors, and that's seen as something that can help clear the stuck stuff in the lungs and help the lungs to stop, being blocked up, but open them up and then release the gunk that's stuck in there.
It's funny you talk about loosening up the lungs. I had a patient this week, and she's a retired nurse, and she talked about, we used to go around and do rounds and do lung percussion. I said, what's that? Well, basically they had the patients hang over the bed, right? So their feet are on the bed and their heads are down by the floor, and they'd pound their backs, boom, 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 to loosen up the phlegm so they could expectorate it. Mm-hmm. And I was thinking about that and some of the essential oil type things you do in the Chinese medicine, some of just those old simple therapies. Now that's if somebody's, near death's door, it's kind of a little too late from that. But early on with a child or, somebody who can handle that type of thing, just to shake up and get that gunk out of there, you may prevent them from having to go into the hospital. So little things like that can go a long way.
From what I read the reports from the doctors in the hospital, like when they do what do you call it when you open up a dead person, you look at the lungs, I forget.
Autopsy. There we go.
Autopsy. You do an autopsy. They found that it's not just like normal mucus. It was like this thick, really dense stuff that patients could not cough up. So it may be helpful in the beginning, but it seems that the patients need the herbs or something like the essential oils to help
Yeah.
make it more fluid or able to be coughed up or dissolved. So
There was a story of a doctor down south. Sorry, I don't have the state where he was. He and his wife got isolated because they both tested positive, and he was listening to their lungs every day, and his wife's lung function started to diminish, and so he started getting a little bit scared. So he thought, you know what? Let's try albuterol in a nebulizer. So he went ahead and prescribed that for her and got it. And that, like you're talking about with the essential oils, being able to loosen things up at an early stage, was able to keep things clear enough and clear it out that she was fine after a couple of days. So I think this strategy you're talking about is the critical key.
Yeah, I think that's why a lot of people in China are getting better quicker from the pneumonia phase, because they're doing the herbals. And I think the essential oils have the same promise for helping patients if they get this far along.
All right. Ready for questions now?
No, we got another one. We got another set of oils based on the third hospitals.
Okay. lay it on us. This is
right.
awesome, by the way. Thanks so much. I appreciate this.
So this is with the Chinese medicine diagnosis is closed interior, abandoned exterior, and the treatment is open the closed, consolidate the abandoned, detoxify, rescue, reversal. So it sounds kind of like, hey, let's go in and, we got these really sick people. Let's go get them. Let's get them better. Let's rescue them. It's bergamot, black pepper. Now, the black pepper oil is actually not like the spice. It's actually very, very mild in terms of its like pungent or taste, but it's very good at releasing mucus and biofilms. And also cinnamon leaf, eucalyptus globulus again, ginger, niaouli, peppermint, pine, rosemary, spearmint, and tea tree. So that's the third set of oils that may be useful for helping patients who are really in this pneumonia, deeply sick phase.
Awesome. Thanks. All right.
Okay. And then there's the last phase, the recovery phase, but we can talk that after the questions if you want.
Let's get some questions, and we'll see if we get to recovery phase.
All right.
So just quality of the oils. I mean, the most basic of all questions.
So there was one study where they compared, I think it was orange oil that was conventionally grown in a farm and to oil that was raised organically or that was made from organic oranges. And they found that in the organic essential oils, there was much less levels of herbicides in that. So for me, I know a lot of people are attached to their vendors and stuff, but for our clinic, we have people who are very sensitive. We want to get them as pure oil as possible. So we use oils that have been extracted from organic or wildcrafted sources, and also have a certificate of analysis, which shows what are the active ingredients and what are the, non-detectable levels of harmful things in there. So we look for that when we're shopping and checking out a vendor's oils. And sometimes, there isn't an alternative. So we rely on the certificate of analysis to kind of guide us in terms of like, is this the cleanest oil that we can find of this type?
Julie has a statement talking about there's a veterinary advisory board with Young Living and that it's okay. So that's interesting. We'll take that into consideration. All right. So, and then Christine also asked again, what is the application for all these? I think you covered that, talking about inhalation primarily, but maybe then internally as well.
Yeah.
If you get some guidance with that. Paula, my good friend Paula Sterling, she has neurological Lyme disease, and big fan of yours, Greg, by the way. And she says, she asks, is the bay laurel essential? Because she has a lot of the other oils.
Well, it's the only one that I've seen that has a research study against SARS-1. I have heard from a colleague of McKay's and I that he heard from a doctor in Mexico that eucalyptus or a compound in eucalyptus, eucalyptol, also inhibits the coronavirus. So there's two candidates, but no, I mean, you can use the other ones to help treat the manifestations of the infection. Of course, we can't say it actually treats the infection because it's not FDA approved to do that. So we can say it treats the symptoms of coughing, wheezing, sore throat, pneumonia, things like that. So it's
awesome.
Just being careful with our words and not making any claims we can't.
That's right. Exactly. And Paul, as a follow-up, her sister has scarring in the lungs. Anything?
That's then they're talking about dissolving scar tissue and then regenerating lung tissue that I am looking into for other patients that have like COPD or other lung damage. But it's really haven't found a lot of like research on what will do both of those things. I mean, when I think of scar tissue, I think about enzymes as a possibility. And then, in terms of supporting lung healing, you'd have to probably go to Chinese medicine and see what is supporting of the lung energies, the qi, the yin. But there's no research that I found, because I've been looking, that really shows you can so much success with that. That's scarring in the lungs.
So I would offer two things there. So first of all, the enzymes make sense, right? And proteolytic enzymes helping to break down some of the scar tissue. The other thing I would recommend having a look at, Greg, is one of the products like Neo 40, the human N, the nitric oxide booster. So that product's particularly a nitrite product. There's some nitrate products out there. And so what happens with these products is as they circulate through the body, essentially the nitrate gets to a hypoxic area, and there an enzyme called xanthine oxidase transmutes that into nitric oxide. So normally it has to go through nitric oxide synthase. So this bypasses that. So the nitric oxide helps with circulation, helps the microcirculation. So it would help the enzymes and other, macrophages that are helping to gobble up the scar tissue get to those tissues, A. And then second, I'd have a look at arginine, particularly as a what is it called? A conditional amino acid. So normally the body makes plenty of arginine, but there's certain cases where the arginine's not available, especially if there's a lot of inflammation going on. There may not be enough so the body can switch over and start the healing phase. So arginine either kind of goes into making nitric oxide for the immune system and really trying to burn up the pathogens, or it goes to a healing phase. And it's really at the pivot between the two. And so it gets made into things like putrescine and all these other funny little compounds that end up part of the healing phase, the rebuilding phase of things. So you might want to look at those two things. I haven't myself, but those are just two fundamental biological switches that I know about.
If we go stray away from essential oils, those sound like good avenues to explore for opening up the kind of dense tissues. Another thing we're looking at in addition is peptides, and how because there's ones out there that are being used like body protection compound to help with healing. I'm currently taking that now, and it's really helped me with a shoulder injury where before I could do this and now I can do this. I can throw things and stuff without pain. So it's been but there's really a couple of research articles on lung regeneration with peptides, but they're really not
peptides
available that I've seen.
Yeah. I ran into a doctor at a conference a couple months ago, and he was just over the moon about peptides. He said, man, it's the next thing. You got to get in on peptides. It's like, okay. So maybe now that I've heard it from you, I'm motivated. And let's see, from my good friend Naomi Mass. So how do you use it with the nebulizer? How much? What do you mix it with? Is it just water enough? Do you need to put some alcohol in there? What do you do?
Nebulizer is experimental, and the only study that I can recall was with Eucalyptus globulus, and you're doing a very small amount. basically you're just essentially it sounded like you're just putting a diffuser into someone's mouth and diffusing it into their lungs. So basically, since diffusing oils is more of a safe, researched method of delivery into the lungs, I would say do that versus, there isn't enough research and data on nebulized essential oils and the safety, because the big concern, because you have all these kids that are now have damage because they're vaping stuff and they're finding out, oh, these compounds aren't safe, so we don't want to have that happen with oils, because that'd be horrible for the industry for one, but also horrible for patients getting injured too, what we don't want. And so we want to make sure it's safe, and there isn't enough data and research on safe nebulization of essential oils.
So once again, we're in a situation where the poison's in the dose and we just don't know how much is safe. So breathing it in through a mist seems to be fine, but a more direct application like a nebulizer, we just don't know. So you don't recommend that.
Yeah.
All right. And here's the last one. So Beth Carrison has started Tick-Borne Conditions United. So you may have heard of them, Greg. And she's an advocate for alpha-gal syndrome. And she has that herself. And she just says that when I was first diagnosed with alpha-gal, I called a friend for help with essential oils. And then her entire medicine cabinet became instantly obsolete. And she loves essential oils.
Okay. So what essential oils help with alpha-gal? That'd be my question to you.
All right. So here's your chance. We'll hang on here. Beth, why don't you, if you got a second, if you could put those in there, we would love to know. And then, while we're
all the alpha-gal, can you eat meat now? And, it's like, lots of questions.
I know she can't eat meat. We did an interview not too long ago. She has good days and bad days, but she's functional now and has really learned just how many animal products are in everyday stuff that we come across that you just wouldn't even think of. It's really amazing.
Yeah.
Resources for Lyme. Yes. So call Greg. Okay, Greg, why don't you give your contact info?
The website is goodbyelyme.com. There are stuff about all sorts of treatments and remedies on the blog there, goodbyelyme.com/blog. There's, let's see, we're populated with more. There's also a lot of articles on there also about essential oils for, Lyme and some co-infections, mold, detoxification, neurological issues. So we're trying to keep as much focused on tick-borne diseases, but as practitioners are seeing in our patients, it's not just tick-borne diseases, it's mold, it's viral, it's parasitic infections, it's genetic issues, inflammation, mast cell. So it's like, how, there's different essential oils that reduce mast cell activation, like German chamomile and lavender, and like lab studies that we're finding are helpful for, Lyme patients, because now more and more of them are showing up with this more reactive mast cell presentation. So, yeah, so that would be it. And then our phone number is 301-228-3764. If you want to give us a call, and we're currently since we're really down on staff, so it'll take us a while to get back to you with messages, because we have a lot of people calling about, how they can protect themselves with coronavirus and all that, our patients and stuff. So, be patient. We'll get to you, but we're, our response is a little slower than normal. So, and
so is everybody else's. So
yeah,
you're in good company. We won't hold it against you. I'll make sure they don't. So Greg, I know I promised 30 minutes. We're already 10 minutes over. There are other questions in the comments. If you have time at some point to swing by and answer some of those, otherwise I'll be doing them anyway. But if you have time, that'd be awesome. But I won't hold you to that at all. Again, just want to thank you so much. I really appreciate it, and tell your family appreciate you giving up time too. You're an important resource, and thanks for being out there and helping everybody.
Hey, McKay, thanks for making it, getting the message out and helping me to share what I have learned. And, I really value just all the great people that you've, being able to share that I listen to. It's just like, well, I didn't know that. I learn something new every episode I hear from you. So it's very wonderful to have you, continue doing this for so many years. So
Yeah.
thank you.
You're very, very welcome. All right. Take care, my friend.
All right.
All right, Miss Aurora.
That was so nice to hear from him.
Isn't he great?
Yes. Yeah, I love listening to him. He's so generous with his knowledge. I love it.
That's awesome.
Well, what really struck me is the distinction between treating the different stages of illness. That really struck out to me today. I mean, obviously that's true with Lyme. It's like you treat an acute infection with Lyme disease differently than you treat the chronic infection. So it's interesting that you have to deal with the same thing with the COVID as well.
Well, it just makes sense. We don't think about things in terms of stages because usually we put things off, there's the putting off stage and then oh my God, I have to go to the doctor stage, right? And so we don't fine tune our approaches to things. And specifically, I mean, that's a very Chinese medicine kind of thing, is there are different stages of diseases. And they literally thought of the disease penetrating inside the body. So first it would go in the skin and then it would kind of be this halfway layer and then it would penetrate deep into the organ. So you have these, that baked into Chinese medicine. And it's funny because right now, the Western medicine, there's a theory out there called the cell danger response. And the cell danger response really begins to take a look at the same idea that there are phases of illnesses and that you have to go through and treat differently in the different phases. It's very Chinese medicine-like, but they're coming at it from a Western point of view, a molecular nutrition point of view, a molecular disease point of view, more what doctors are familiar with. So yeah, thanks for bringing that up. All righty, that's going to wrap it up for today. Thank you all for joining us. And do you have anything else, Aurora?
No, we'll get to your questions as soon as we can.
We'll get to questions and comments, and we'll see you next week at 8 p.m. Ciao.
Bye.
Greg.